Good evening. A historic day as the number of coronavirus cases in Tennessee passes the 100,000 mark. Coronavirus deaths pass 1,000, and now new concerns about the effect on our children.
As we try to figure out how to get safely back to school, News Channel 5 Investigates discovers a rise of COVID-19 among school-aged children. That number up by a third in just the last 10 days.
And our chief investigative reporter Phil Williams is keeping close watch on the data. Phil, doctors you spoke with are worried.
Yeah, no doubt about that, because pretty much everyone agrees that as schools reopen, it's not a question of whether there will be more COVID cases, just a question of how many and what happens to the people infected. And these numbers are likely to get much worse.
We are the Rutherford County School Board. We work in education. We don't work in medicine.
Rutherford County's Board of Education voted Tuesday night to reopen schools, even as doctors.
It's just not safe yet to send everybody back to in-person.
Tried to sound the alarm, among them Dr. Nick Cote, who has one child attending the school system, another who is a teacher.
Now that we're starting to see data on children, because kids are actually starting to get sick, we're seeing very much an increase in the rates of infection among children.
The latest data shows Tennessee went from 6,827 school-aged children with COVID-19 on July 18th. Just 10 days later, it had jumped to 9,085. That's a 33% increase. Davidson County was up 20% with 266 new cases among children. Rutherford up 35% with 151. Murray County up 61% with 46 new cases. Cote expects that just like the flu and other respiratory viruses spread among kids in school, so will COVID-19.
Even if they don't get critically ill, which we are seeing critically ill children with COVID-19 throughout the country, but even if they're not getting critically ill, the problem is they're bringing that infection home to the adults in their lives. And they're able to infect the teachers that are in the classroom.
We've outlined the risks associated with children not being in school.
Tennessee Governor Bill Lee insisted Tuesday that schools need to reopen with in-person classes, despite guidance from the CDC that it is important to consider community transmission risk as schools reopen. The Lee administration's own map shows almost the entire state, the counties in orange, have unacceptable rates of COVID-19 transmission.
You can't pick and choose what agency you're going to listen to. So
J.C. Bowman with the Professional Educators of Tennessee worries about what happens to teachers.
But obviously, there's a great risk out there for people as they return to things. We need to be careful. Initially, we'd like to see them, move back, start a school to after September 1st.
I am thankful to the board for your unanimous decision to reopen our county schools in this way.
But the Rutherford County School Board meeting revealed how that even as more children are getting infected, the science gets muddled, as one maskless board member shared the opinion of a local chiropractor in support of the notion that there's really nothing to worry about.
Let me be clear. Face masks do not effectively block the transmission of viral respiratory particulates, and they should not be worn by healthy individuals. Medical science shows us this.
This is a chiropractor, just to be clear.
It's inexcusable, and especially when there's two board-certified physicians sitting in the audience who just told you that this is dangerous and we shouldn't be opening.
So what does the scientific evidence show about the effect of COVID-19? Well, children are less likely to get sick, although at least 3 have died right here in Tennessee. But kids 10 to 19 are just as likely to spread it as adults. And that's what doctors fear for the teachers and fear that kids being kids, they'll spread it and take it home to their families. You can check out your county's numbers at newschannel5.com.